JJ's just taking a brief break.
Okay.
He'll be back. Um,
Yeah. If I may respond to your mask comment,
Yes.
in in the context of what I said, when I go out in the community, I'm reading people. I'm not just saying how are you in a routine way. I'm actually reading people, and I'm meeting what I see their needs might be.
Hmm.
Masks remove that ability to connect as well, even with social distancing.
Yes.
I can't see how people are doing,
Yes.
right? And that's very important to my style, right?
Absolutely.
It's also, I think, important to other people, but it also affects me not to be able to do that.
Correct. That's beautifully
Yeah,
said. Yeah, it's
yeah.
beautifully said. Yeah, I mean, I think JJ mentioned that in our conversation last week. He said, well, I mentioned to him it was week 2 of what was happening throughout the world, and I'm making observations from my colleagues all over. And the first time I had seen a medical team in Israel, fully in protective equipment, they had realized early on they had lost the patient connection, the human connection. So they had printed their faces on paper and taped it to the. This is who I am. This is the smiling face of their, who they are, who's coming to their bedside, because they had lost that, right? And that was in the healthcare environment, but now you're talking about in the community. You're all walking around without being able to read each other, to actually see what someone is feeling, and in a very, very close knit community like you've experienced yours is, that's extremely it's a huge loss.
I
Sorry,
think
Jake,
Mr. I
was
think Mr.
asked you
Rogers.
to join. Go ahead, John.
I think Mr. Rogers should be an advisor.
Yeah. Yes, absolutely. JJ, were you able to capture or follow some of our conversation so far?
Oh yes, I was. And
Okay.
I really like it that John's commentary came on the heels of Karen's question for me, which, I must confess, I sort of reflected back in more complexity because I don't have an answer. But as I hear what John said, and I think about the themes that are embedded in Karen's question, the thing that comes to my mind is that we as human beings have always simultaneously put great value in what makes us similar to each other and the same and brings us together. And at the very same time, we very much do value our own differences and our individuality. And thinking about those two concurrent themes of what it means to be a human being in parallel and doing our best to try to integrate them, hold them in tension, balance, and really recognize them, truly recognize them, is I think where the right pathway through comes out. What do I mean? So there's a sameness to the reality, as I sort of flippantly said, we're all petri dishes before. We are all the same in that way in terms of what we as bodies add to the risk pool for all of us as a community. So that's a biological, that's a physical, related to the pandemic similarity. We also have some similarities in that regardless of our differences in terms of who we like to hang out with or how we do it or how we associate, Aristotle said we are political animals, and he used that term with a small p, meaning the way that we organize, the way that we think of ourselves in relation to others, and the way that we go through as part of a species, collectively, but as individuals, it defines who we are. So that's a sameness. But there are vast differences. Some of us have a really strong risk toward having an addictive problem, and that's dangerous in a time where we might now be indulging alone and not have the balance of people to keep an eye on us or support us in our sobriety-based communities where we need that togetherness. I think of Alcoholics Anonymous trying to find ways to meet at a distance now when they have depended for decades on sharing horrible coffee, having a cigarette outside, and meeting together with hugs and closeness of sharing of testimonials. And now they can't do it the same way that they did anymore, right? And so
Yeah.
there's difference there in that group's risk, where now other folks say, well, I don't really care whether the liquor store is an essential business or not. Doesn't mean a damn thing to me.
Yeah.
Because I like iced tea, So look at that difference. And so how the person who drinks iced tea could very easily then say what? Close the damn liquor stores.
Right.
This is simple, this is easy. And the folks who have a very different relationship with alcohol say, how could you possibly dismiss me along with you're throwing me out with your policy that you say is mathematically based and the right thing to do. And so I really love it that Karen asked her question, wondering about the possibility of some sort of mathematical equation. But I want us to be anti-mathematical and cut through it with something that is more nuanced and honest about humanity. And what would that mean? Practically, that would mean recognizing that there are some people we need to find very creative ways to be closer to, even if the risk is a little bit higher.
Yes. Okay.
But they will die if we don't do it that way. So
Yeah.
we've got to find, and that would mean, making sure that we can keep chemical dependency treatment programs open, keep social programs open, think seriously about what it means to have a church community function, but also balance the reality that mega church behavior in its traditional way is absolutely not acceptable because we're going to kill people, right?
Yeah.
But there's got to be a way that flexes, that recognizes difference.
Yes, yeah, I love that you brought that up because yes, absolutely. The differences, it's so crucial to embrace the differences.
Yes.
So one of the things that came up earlier, I think it was 5-6 weeks ago, why are they keeping the liquor stores open? And a bunch of doctors said, do you know how many people would show up at the ER with DTs? That's what we call the delirium tremens, the
Horrible alcohol withdrawal.
Yeah, horrible withdrawal. Because we don't want them, we don't need them near our hospital right now. Keep the liquor stores open. And it wouldn't be a few, right? It would be hundreds, perhaps thousands that are daily drinkers and heavy drinkers. And we don't have the bandwidth to deal with them right now, but we let them, it's not ideal, okay? There are certain things that are not ideal. That's one category. But I think that one thing that John brought up which is another positive deviance, and that's negative. That's how we deal with a negative problem. With a positive deviance is you've got a community. Should we have, and should we still allow people to feel different levels of risk? Okay, so for example, we said all across Pennsylvania, whether you live in, the middle of the state with 1,200 other people, or whether you live in a suburb of Philadelphia, y'all are going to have the exact same requirements, okay, of how to deal with this.
Right.
And so when you blanket requirements, you're taking people's autonomy to make the risk assessment themselves, right? So I know that even the difference between me and the way I behave in the back mountain of Wilkes-Barre versus the way I behaved when I went to see John today, okay, in Wilkes-Barre, is different. I knew I live in a lower risk environment 4 miles away from him.
Yes.
Okay. And so what John was mentioning about, his routine of assessing his community members individually being lost just by the fact that they're wearing masks. Were they all necessary? Was there even a COVID risk for some? And that's another failure of data, right? On my end of the spectrum of healthcare is evidence-based action, right? So was there data enough to say John's community has to behave the same way as another community, right? So anyway, so go ahead. I'm going to leave that open to you to talk about.
Oh, it's great. I don't have too much to add, except it has me associating to something which, is a little dicey because it's not the it's not the forum here, but think about one of our major political problems we have in the United States. We have an urban-rural divide. And one of the things, although certainly it does not define every individual's life living in every city versus every Holt and Heath and farm community, it doesn't define each individual's experience. But in general, we might have done a better job of meeting the needs of most urban dwellers and most rural dwellers had we been honest about a differential risk right from the beginning and said, those of you who live in cities, guess what? You already know that your lives depend on an intrinsic level of trust of many, many more humans on a day-to-day basis than people who live in the hinterlands in lower population density. You've already embraced this, right? You walk out into an intersection based on the color of the traffic light, and you trust all those cabs to not plow through and take you out. Those rules are set up for the cabs to behave and you behave. And there are countless ways in which, when we have higher population density and people coming together, people who thrive on those kinds of environments and choose to live in them also have already acknowledged that there are more ways in which their own behavior and the behavior of others are defined by some guidelines. And so if you ask that population to please, pretty please, with sugar on top, wear the mask.
Yeah.
Say, well, sure. Relatively speaking, they are more likely to embrace it quickly and say, yeah, I get it. I'm constantly within 2 feet of spitting distance of so many people every day. I totally get the idea. But why in the name of God, as you said, ask somebody in the middle of a wheat field in North Dakota to do exactly the same thing when they have up to this point lived a life that has not been defined by tons of rules to govern safe interactions with tons and tons of other humans, because that's not how their lives have been. Do they need to be now to the same degree? And that's really disheartening that we didn't recognize that aspect of difference.
Yeah.
And the reason why I pointed to politics gently earlier on was think about the redness and blueness of those places, and think about the kinds of leadership problems that we've got, and think about the areas of resistance to science and guidelines. We didn't actually have to get heavy-handed with folks in those redder areas in general and say, you must, you must, you must.
Mm-hmm.
We could have said, just think about this. It could be coming to your area. Please be thoughtful.
Yeah.
And would be some good things to do. And that level of intervention would have been, in terms of the need, equivalent to really telling people in cities,
yeah,
stay in, stay in, stay in. And those, bluer folks who tend not to automatically resist those kinds of edicts would generally not have been dissatisfied either. We right? So we could still do that. I'm not saying, oh, I wish we had done it. The opportunity's lost. The opportunity is not completely lost to actually re-look at that.
Yeah.
But we have a leadership void. We've got some great ideas that we share here in this webinar, but we have a difficult time taking what these neat things that pop out of our chat and putting them on the desk of somebody with a big signature, to
well,
make.
I